Greetings. Welcome to another episode of, Arnell, actually, somebody in the audience asked, what is the name of this podcast? And I didn't have an answer to that question. Do we have an official webcast podcast name?
Yes, this is actually an AI unlocked series.
There you go.
I
AI
like it.
unlocked.
AI unlocked. I
Any
like
day I
it.
can learn something new.
Well, shoot, you got to have my son on next from Transformed Intelligence because he's got a lot of insights.
That'd be fantastic. That'd be fantastic. Well, Darin, welcome back again. We were blessed to be at the California Assisted Living Association conference called Elevate this week. Darin and I got to speak on Tuesday morning, and that is the gist of today's conversation for everybody across the planet who was not able to make the Elevate conference. We had a good time doing something that I've never done before. We've never done before. And I would say that'd be a collaboration between front of the house and back of the house, all merged up in the world of technology, AI, virtual reality, the whole nine yards. And they gave us every other year I've done this. I think this is my fifth year speaking at this conference. It's only been 60 minutes. We had 90 minutes, which is, I've never been on stage for 90 minutes, but the time was managed well. I would say it flew by because I don't think it's possible for 90 minutes to fly by, but we got through a
But
lot.
Lance, let's be honest. You could have talked for 3 hours and on this subject for sure.
Only the things I'm passionate about. Otherwise, I got nothing to say. So yeah. So today is a recap session, technology that transforms the culinary experience. We just want to kind of go back and forth as to the high level topics because we got to condense 90 minutes of material into about a 30-minute webcast here. So why don't we jump in? Unless there's anything you want to share before we jump in, Darin?
No, I was just going to say I was so passionate about seeing Lance there. I landed in Vegas and was engaged with this conversation with this gentleman at 11:30, and and I missed my flight because I normally look at my iPhone and I was flying Southwest, so I ran to go try to catch it. Didn't make the flight, and then drove from Vegas all the way to Palm Springs, 4 hours. Didn't arrive till 3 a.m. And that's how passionate I was about being there for this conference. And Lance, so thanks for joining us.
Absolutely. It worked out. All things considered, it worked out incredibly well. So, Darin, let's kick it off. I'll throw the ball over to you. From your experience, what are some of the biggest gaps between culinary operations and technology in senior living? And how are you and your team working to bring them all together?
Yeah. Well, I think first of all, you said it a couple times during the conference that really hit. You said your biggest competitor is pen and paper, right? And it's like that's the same for the culinary industry as a whole, from the front of the house to the back of the house. Everybody, is so used to just picking up their pen and paper and writing out stuff. And when you said that, it just reminded me that I had a big event that I was doing with a team, and I had a chef there, and he, back in the day, like, it was awesome when chefs would actually have a notepad in their jacket pocket and be taking notes, and I would look at that and I would go, ooh, that person, I like that. They're planning, they're understanding, they're being proactive and intentional. But this time I actually thought to myself, why are you wasting your time? Why are you wasting your time doing that when you can just pull out your phone with ChatGPT or whatever source you use and just produce the production list and from the recipe and get your check mark list right from there. And I remember saying it to him, and he's like, yeah, I just haven't really adopted AI, and I know that I need to. And I said, well, let's do it right now. So we took the recipes. There was about 5 recipes, and we had a whole production grocery list of what we needed to do, and we knew the menu, and we just really quickly plugged it into we were using ChatGPT, and bam, he had his list, and it was all itemized with when he needed to execute and have everything ready, and that took us 30 seconds. And so he was like, you just saved 15 minutes off my day. And so sometimes I think we have to handhold everybody. We have to show them, like, what does it mean to incorporate AI? You know, what do I need to do? How do I start? Let's show them the basics of something as simple as that. So that just resonated with me, Lance. And then the bigger picture of it, thinking about just in general, like I think if you're not using AI, if you don't have POS systems, if you don't have KDS monitors, you know, everyone does. Everyone's moving in that direction. And senior living as a whole is always 10, 15 years behind the restaurant hotel industry. So if you want to know what you should be doing, just go into a restaurant and hotel and start adopting these tools. So great question.
Yeah, that's kind of how we kicked this whole thing off. As we asked the audience, I love this concept of a blind survey. So everybody closes their eyes, and we threw out the question here: Who here today? And I get a head count. I'm going to estimate maybe 80 to 100 people in the audience.
Yeah.
Of all the people in the audience, the question was, who's using AI every single day to improve their personal and professional lives? We had half the hands go up. So half of the people were not using it. In fact, I mean, most of them weren't using it at all, let alone on a daily basis. So we had a good blend of folks. Also, we had sales and marketing there, we had operations, we had culinary, we had a good segue, a good segment of all the different major job roles there within senior living. And so going into it with the realization that the adoption rate for America is slow, the adoption rate for senior living ops and restaurant hospitality ops, hotel ops, it's all behind the American learning curve. And so it's a great opportunity. It's a great time to really engage. And that fired into this next question. This, for me, this is a paradigm change because I've been making this quote public every class I teach for the last 2 years. And that's don't worry about AI taking your job. Let's get rid of fear. Worry about somebody using AI taking your job. But now in the year, and I don't think it's 2025, I think it's 2026, the year of agents, agentification, we're now going to have automated software agents that start eliminating menial tasks. And I love that because if we could take the menial tasks away from the senior living community, executives and hourly staff, those folks can spend more time loving on the residents. How do you see this transformation affecting the back of the house, Darin?
Yeah, no, definitely. I think we have to, this is just my honest truth. Like, I really think we should allow people to have their phones in the kitchen. Like, I know HR is like, well, what are they doing? What is everyone doing? It's like, come on, just let people use their phones. Let them have an earpiece and listen to music. Like, this is how the younger kid generations operate, and they're fine being productive in that environment. So I'm an X generation, and the baby boomers would have nothing with it, right? Like, but the Y generation, the Z generation, I think it is, that's just how they operate. So I really think that we should let them bring their phones and let them use them for their efficiencies. I think that we should give them parameters and say, hey, you could use AI to do this, this, and this, right? I think we will learn from that. Like in the case of the example that I just gave you, that I know as a manager, I'm like, are you actually being productive at work, or are you talking to your girlfriend, right, or whatever? Like we tend to think that, and that's why we're like, you can't bring your phone here. But I really think let's start to change what we're doing from that perspective, because there's so much automation we can do with training, right? So like if we had a training session that we wanted our teams to watch, like pull out your phones, let's all engage in that training aspect and watch it together. So I do think that that's number one, is we have to change our thoughts as managers about the technology that's in our hands, and let's leverage it while we're there. So honestly, that's number one. And then what are you doing that's not AI? Like how are you, like when I talk about like ordering or recipe development, or even photos of different food items, like let's start using AI to help with these functionalities and engaging with companies that have these automated features within their platforms. And if you're not doing that, start to engage with companies like ServingIntel, or there's lots of other POS companies and menu software companies, but ServingIntel is really good. But that would be what I would say is definitely change the mindset of culture of not allowing phones in your workplace.
Yeah, no, I agree with you. And that's one of the slides we came up to next. It's the bring your own device is the future. So we're in complete alignment with that. And it's using web applications as the portal to be able to interface with artificial intelligence. And so our team, we talked about this literally this morning. We might have bit off a little bit more than we could chew as far as being an early adopter of facial avatars, lip syncing, and we went all in to create as human an experience as possible when folks are interacting with our web application. For service staff and for EDs operations, maybe you don't need a talking face. Maybe that'd be better suited for the residents where the pace is a little slower, the conversations are a little slower, and how they go back and forth. Not that latency is an issue, because it really isn't an issue. It's more fine tuning. But definitely, we're dreaming of the day where not just the artificial intelligence serving the employee to be able to serve the residents, but the AI serving the employee to take the orders at a table. And so, an AI that listens to everything that's happening in the background, that smart brings things up. You can jump into virtual reality.
Well, I'm doing a play off this because I think, we have to incorporate the virtual reality aspect. It's been around a while. Like this is an Oculus, and you can tap into the meta world. And so, one thing that's really cool about this is, so even today at 2 p.m. we're doing a transform culinary kit front of the house training. So we have one of our front of the house managers doing a live training with, we have 15 different properties. I won't say who it is, but he's a master sommelier, and we have a whole spelled out functionality of it, but we're going into the virtual world. So like actually the service staff are going to be going into a dining room that we built using LiDAR of their full kitchen schematic. And these servers, that a lot of them come from McDonald's or Arby's, and they don't understand, what is service, and how do we do it in senior living, and what is this proper sequence of service. Well, guess what? You can now go in like a video game and actually learn how to properly set up your table and what that sequence is, and see other avatars of people engaging with it. And Lance, what's even really cool is we've actually created, one of our celebrity chefs is in the program as an avatar, and so you could ask, hey, Chef Steve, did I set this table correctly? And he would be able to respond, actually, no, the fork goes on the left side. You need to start over. And they could actually throw the fork at him and be like, be quiet. But that's the future, Lance. It's like, we don't have to be, there's so many ways we can engage. So I just thought it was fun when you were talking about that.
Oh, absolutely. I completely agree with you. We also talked about the impacts and predictive healthcare, all of the IoT, the Internet of Things, all of the sensors, the wearables. I had mentioned that I bought this watch on Amazon. Absolutely love it. It's not a name brand watch. I had a Samsung Active for a long time, and it finally broke. I got this watch for $52 on Amazon that works with the Android operating system, and it does the blood pressure. That's the newer sensors, not just how much oxygen's in the blood or what your pulse is, but I'm actually getting my blood pressure monitored numerous times through the day and graphed. So we're moving very quickly into that world where sensors are everywhere, and senior living communities are going to be able to use AI to get proactive action plans to be able to eliminate health issues and reduce the cost of care. And then you talked about Meta and
Yeah, hey Meta, take a photo. So just snapped a photo. Now I'm recording this
see the one.
conversation, You can see it recording. So what's so cool about it is I can even say like, what's the weather, what's going on. I can connect the AI feature to this. Now we use it to train our chefs too. So it's a point of view. We'll record what they're doing so we can go into a live stream and see like how are they cutting vegetables or what are their teams doing. But I definitely like, I think even going to different countries, you could just be like, hey, what does that say in Spanish, or what does that, say in Chinese, and like it'll read it to you. So I think, the future is going to be wearables too, and I know that the technology of this is coming that's probably going to be able to take your blood pressure and how your sleep was and everything. So I just start engaging with this stuff. It's so fun.
Yeah, absolutely. And finally, in the what's happening in the world of senior living and AI today, we talked a little bit about communications and insights. The ability, AI is not just an engine or a solution that collects information. It analyzes the information and then passes the information back out. And so, communications are being enhanced with AI through a number of different scenarios. And one of those is simply communicating proactively, not only to family members, but also to
Mm.
staff. We talked about a project we have going on in Ohio right now where the CEO, she wanted keywords tracked when the residents are interfacing with the digital assistant. And it was the insurance agency or industry, the insurance companies a couple of years ago wanted the operators to have nothing to do with AI. They were all worried about lawsuits. And now, 2025, that's flipped. And now the insurance industry is wanting operators to get involved in AI in order to proactively prevent lawsuits. And the
Mm.
specific one was slips and falls. And so the technology really is moving beyond front of the house, back of the house. You mentioned a 4 hour drive. I took one after the fact and drove from Palm Springs over to Phoenix and spent the afternoon with an operator there. And what I'm starting to realize is we're working more today with the executive directors and the community leadership and the culinary team, where before, for 15 years, it was the culinary team and occasionally ops or occasionally IT. So the technology is becoming more holistic in all of the ways that you can serve. And then, of course, with the agents coming online, we're able to look at any job code in a community and see what are the opportunities to eliminate that job code. We talked
Mhm.
about object character recognition, OCR, scanning receipts and having an image converted into an Excel file that goes straight into the accounting system that hits the income statement. How many different ways can we positively affect net operating income and occupancy rates? And that's where we're moving quickly into the pilot situation that I'll talk about a little bit later. You had mentioned what opportunities we have together to serve, combining front of the house, back of the house. How do you see Transform and ServingIntel moving together as we get into 2026?
Yeah, I think what's exciting actually, Lance, is the KDS units. I've had a lot of senior living VPs of dining directors that are in charge of multiple communities, and this is a struggle I had when I was in that role. Is that when one community had, let's say, a chicken parmesan or something like that with this, linguine, and then they had a special brownie dessert, it was always like cooked differently. It was plated up differently. It depend on what if Sally made it over here and Johnny made it there. Like the residents hated it when Johnny makes it, but when Sally makes it, it's great. And I think that we have an inconsistency issue in healthcare and senior living. We haven't figured out how to standardize things like the restaurant industry, where Starbucks, for example, I always get my Americano, and it doesn't matter where I'm at, it's always tastes the same, it's delivered the same. And the same with McDonald's, right? Like my son said, imagine if you got your Big Mac and it had ketchup on it, or mustard, and it's a Big Mac sauce. And it's like, honestly, that's frustrating. That's happening across the board. So how I see us working together, honestly, is really through the AI recipe functionality that we are able to develop through transformed intelligence, because now we can actually develop recipes through whatever whatever dietary need you have, whether you're a puree or low sodium or on a special cardiac diet, we can generate those recipes very quickly and actually spread them out like dietitians, but even to the point of what is it that your doctor's asking you to prescribe? So one of our members and I just found out, we just brought her on board yesterday, Dr. Lauren Powell, who is known as the culinary doctor. So she's coming on board our team to really talk about, like, if somebody is on cancer, what are the foods that they should be using that support their wellness journey? And so what I'm excited, Lance, is honestly bringing that to life, but then also having the finished plate presentations of what does that look like on a plate? What is the plate that this should be served in? So that you can maintain the primary food colors of red, green, and yellow. Is their plate presentation? Is their height? Because residents and patients and all of us, we eat with our eyes. So if we can create consistency like a Starbucks or a McDonald's in the healthcare senior living setting, we can improve lives. We can improve food. So that honestly is what I'm really excited about partnering with, because you have the technology. You have the technology to be able to display and start to move. And I know that there are so many senior execs right now that are looking for that consistency in product. And I think there's so much that comes from not only consistency, but cost management, inventory control. There's so much. So I'm excited to keep partnering with you.
Yeah, I'm dreaming about something. It has bothered me ever since we were brought into the senior living world. It's the concept of a rotating menu. I
Yeah.
mean, for whether it's 4 or 5 weeks, I've seen them go out as far as 15 weeks for a community. That idea that you're going to take something like meatloaf, and meatloaf is going to be on the third week and it's going to be on the Tuesday at dinner time, and then spaghetti, chicken marsala. You have all of these items that, hey, it offers variety, but there's no crossover, and you end up with a lot of food waste. And so we created an algorithm that forecasts how much a chef should make, but that's not the way, that's like, that scratches the surface. It saves money. But really, Darren, what we should be talking about is having a world of recipes. And the recipes, it's a balance of variety and ingredients in house. And that even needs to be tied to another level, which is affordability, where if the price of tomatoes, the price of avocados, whether it's seasonality or there's a logistics issue, the cost of an ingredient spikes through the roof, we simply generate recipes automatically on a daily or 1 day ahead basis that takes advantages of the ingredients where the cost is coming down as opposed to escalating, keeps the variety, the freshness in mind. And I love the idea of senior living communities buying whole ingredients
Yeah.
from their purveyors. And that thing that used to be called a nutritional label, it's now called a warning label. If you have a label on the side of something, it's warning you about something that's in the product. I want to see more chefs being able. Why does? And I'm going to ask you this pointed question, Darren. Why does an individual ever want to become a chef?
It's a great question. Well, and it's so funny, this framework for AI success. I'll admit, we wrote most of this through AI, but I think what I love is the picture of showing, like, the craziness of a kitchen. So that's the answer to answer your question. It's chaos in a kitchen. There's so many relationships. There's so much food coming in. There's menus you have to write. You have to manage inventories. You have to train people. There's so many variables in a kitchen, which is probably why 95% of them fail in the first year, 90% fail in the first 5 years, because it's absolutely difficult and mind-blowing. And honestly, what is exciting about this slide is it reminds me to get my restaurant going. So I'm going to be building actually we have a barbecue brand called Sasquatch Smokers. So we're going to be creating in 2 years, maybe less, Sasquatch burgers. And I'm going to entirely design the entire restaurant with complete automation and AI robotics. So there's going to be no one in that restaurant as much as possible, but we're going to actually do the business plan, everything. And it's going to follow this automation, because as chefs, if I can solve those issues and not have to, have a rough time sleeping at night, worrying that my chicken is going to go bad and I forgot to put it on the menu the next day, and there was no automation reminding me, hey, you need to put the chicken on the menu. That's the kind of stuff that us as chefs are always stressed out. But the reality is, why do people get into it? Is because it's crazy. Because there's absolute chaos and nothing is organized. And so I think that that is why people get into it. And it's an environment to be creative. But I think through AI, let's start to kind of reduce some of those headaches that kitchens have and bring out more creativity and passion in the chefs.
Yeah, the community that I visited just yesterday in Phoenix, 300 residents, an IL community, and I spoke to the dining director. This was her second job in senior living specific. She was in restaurants beforehand. I asked her what she enjoyed about her position. She lit up when it was the creativity piece. Most senior living communities, you're not a chef. They say you're a chef so they can sell it to the residents, but the reality is here's a recipe, make 60 of these, don't deviate. And so the ability to use AI to analyze nutritional information, to be able to serve the people that have allergies or they have dietary needs and deliver a product where that person that's running the show can smile, knowing that they have ownership, they have a piece of the success and satisfying in serving the residents. That's really where I see senior living going. But you can't do that with pen and paper. I mean, that's it's to go back to what we said a minute ago. Pen and paper is not a business system. It's an opportunity to lose data and make residents upset. That is pen and paper. Oh, and third, have your staff spend hours and hours every month compiling stuff manually that they should not be compiling. So I'm kind of excited to see where all of that is headed. With everything that you're building, the divine wellness over to the culinary kits that you mentioned earlier, what are your outcomes? What matters the most to you as we're moving into 2026?
Yeah, well, what matters most to me, honestly, is for me to share the gospel with every person that I meet. And so my company, Transform Culinary Solutions, is inspired by Romans 12:2, which is do not conform to the pattern of this world, but be transformed by the renewing of your mind. Then you'll be able to test and approve what God's perfect, pleasing will is for your life. I found my purpose and passion. My ministry is the food and my pulpit is the kitchen. And so honestly, that's what's inspiring for me, is that I'm not going to shy away from that. And I want to share God's love, the gospel. Jesus is number one in my life, and now I know he's got my back, and he's going to be bringing all these resources and amazing, talented people so that we can continue to share the love of Christ throughout this entire world. And I'm just excited to go forth and take all the tools, resources to make number one, the food better, the dining experience more engaging and exciting, and to do it with partners like you, Lance, and the incredible organization you've created. And congratulations on 16 years of success.
I appreciate that, Darren. It is that's that's a conversation for another day. I think it'd be a fun one. Serving Intel is a Christ-led organization, and there's not really there's a biblical blueprint that companies have put together on how to do that. Then there's the reality, kind of like running a restaurant.
Yeah, right.
The best of intentions end the day you open your doors.
That's so true.
That's when the madness occurs. So there's a couple of things I see us coming away from the conversation. First, it was a blessing for me, and it was for you to be able to serve all the folks there at CALA. We want to thank Jan for inviting us out yet again. This was a new idea we threw at her, and we're grateful for Jan and Kate for picking us up and running with this along the two side of us. Business operations. Another thing too that really struck me is food is medicine. We talked a little bit about that after the conference. the opportunities to use artificial intelligence in order to create recipes that serve the residents from a health perspective. And I like your holistic approach, Darren, body, mind, and soul. Too often the spirit, the soul part of our residents gets left out. And there's
Mhm.
just such an amazing opportunity that we have to do that with the experience of dining, because it's not just about the food. I'm a foodie. I'd say food's number one, but boy, it's the human interaction, like in this picture that we're showing right now, engaging residents through intelligent hospitality. It's the merging, free up the staff so they can spend more time with the residents, free up the kitchen so they could be more creative, serve more spectacular food, videotape it, share the experience through social media, and all of that will increase the satisfaction, the longevity of the senior living residents that we serve.
It's so true. Like you
Close.
reminded me of Lance, if all we, Jesus washed people's feet,
Yeah.
right? He served. He was the first hospitality person, providing a great experience, for that time zone. And I think that here you have a smiling resident and a smiling staff. If we can create more efficiencies to allow us to wash more feet and serve our patients, our residents, our customers, that's the blessing right there.
Amen. Amen.
Amen.
Well, thank you for joining me twice in 1 week, back to back.
Thank you,
Thanks.
everybody, for
Yeah.
joining. Have a
Yeah.
great rest of your day.
Yeah. Thanks for coming in. Watch, like, subscribe, share this with folks in your organization. And Arnell, our director of marketing, puts out a link. If you ever would like to have a 30-minute engagement at no cost, just to talk through some of these concepts, just get a hold of my calendar, put yourself a slot, and look forward to working with each and every one of you.
We need to talk our now because I got a live stream going tomorrow. I probably need your help.
All right, awesome. Make it a great day. Thank you.
Thank you.